Presentation on community-acquired Mrsa. Say hello to Staphylococcus aureus. After all, it has probably said hello to you. Getting to know Staphylococcus aureus. The Staphylococcus aureus bacterium, commonly known as staph, was discovered in the 1880s. Staph is the only disease-causing bacterium that is carried without causing infection by a substantial slice of the population. Staph is a bacterium that knows how to live on inanimate objects, in our noses, in our skin, in our genitals. 1/3 of all people are colonized by staph. Staph skin infection can present in a variety of ways, including hair follicle infections, boils, abscesses, and impetigo, the school sores, eczema, cellulitis, secondary skin infections of wounds, dermatitis, scabies, and diabetic ulcers. In modern society, staph is a controllable nuisance. Once antibiotics were invented, bacteria fought back and staph evolved, introducing the superbug. First came Mrsa, methicillin-resistant Staphylococcus aureus. Mrsa is resistant to an entire family of antibiotics called beta-lactams, including penicillin, amoxicillin, oxacillin, and methicillin. Mrsa preys on people in healthcare settings where infection and antibiotic use are commonplace. Mrsa kills over 11,000 people a year in the United States. Why do bacteria become resistant to antibiotics? Antibiotic resistance is a natural phenomenon. When an antibiotic is used, bacteria that can resist that antibiotic have a greater chance of survival than those that are susceptible. Susceptible bacteria are killed or inhibited by an antibiotic, resulting in the survival of resistant strains of bacteria. Some resistance occurs without human action. However, the current higher levels of antibiotic-resistant bacteria are attributed to the overuse and abuse of antibiotics. In some countries and over the internet, antibiotics can be purchased without a doctor's prescription. Patients sometimes take antibiotics unnecessarily to treat viral illnesses like the common cold. Mrsa further evolved, introducing Mrsa, community-acquired methicillin-resistant Staphylococcus aureus. Acquired? Mrsa's deadly new strain infects healthy people. It spreads in communities, in child care centers, in athletic facilities, in crowded living conditions such as homeless shelters, military personnel in barracks, and in jails. Centers for Disease Control and Prevention emphasize the 4 C's as risks for transmission: crowding, contact, skin-to-skin contact, contaminated items such as towel surfaces, and cleanliness or lack thereof. A short history of Mrsa. The epidemic community-associated Mrsa strain was first found in Australia in the early 1990s. It spread globally and was first reported in the United States in 1997 as a sometimes lethal infection in children. This severity was unusual because the pathogen was community-acquired and the hosts were healthy. This figure shows the global outbreaks of community-associated methicillin-resistant Staphylococcus aureus infection from 1997 to the year 2000. As noted by this map, many of the epidemic countries are so-called first world countries. CA MRSA starts with a simple infection. CA MRSA most often enters the body through a cut or scrape and appears in the form of a skin or soft tissue infection, such as a boil or abscess. The involved site is red, swollen, and painful, and is often mistaken for a spider bite. CA MRSA can develop into more serious invasive infections, such as bloodstream infections or pneumonia, leading to a variety of other symptoms, including shortness of breath, fever, chills, and death. Family Practice Management Journal suggests every physician assemble a toolkit to improve treatment of CA MRSA. The concept is to treat abscesses surgically rather than defaulting to write a prescription. Having a tray already assembled with all the necessary surgical instruments and patient handouts is a time saver to treating and educating patients on CA MRSA and complies with CDC recommendations. What can we do? The official statement from the National Athletic Trainers Association on community-acquired MRSA infections was written as guidelines for athletes and athletic facilities, but contains many common sense suggestions we can use. And they are as follows. Keep hands clean by washing thoroughly with soap and warm water or using an alcohol-based hand sanitizer routinely. Encourage immediate showering following activities. Avoid whirlpools or common tubs with open wounds, scrapes, or scratches. Avoid sharing towels, razors, and daily athletic gear. Properly wash athletic gear and towels after each use. Maintain clean facilities and equipment. Inform or refer to appropriate healthcare personnel for all active skin lesions and lesions that do not respond to initial therapy. Administer or seek proper first aid. Encourage healthcare personnel to seek bacterial cultures to establish a diagnosis. Care and cover skin lesions appropriately before participation. Cleanliness includes your technology. Staph bacterium love plastic surfaces. Since most keyboards and mice are made of plastic, they are attractive breeding grounds and can live for up to 3 months on most plastic surfaces. And certain strains have shown the ability to live for as long as 9 months on plastic. Even the president got involved. September 18, 2014, President Barack Obama issues an executive order establishing a new interagency task force charged with developing a national strategy to combat antibiotic-resistant bacteria. The latest breakthrough is TXA-709, combined with cefdinir, an antibiotic that has been on the market for almost 2 decades and can be taken orally. Is it just in time? May 2016. The first case in the United States of a patient with an infection resistant to all known antibiotics was reported by the U.S. Centers for Disease Control and Prevention. Superbugs. Some speculate 10 million deaths by 2050. Antibiotic resistance currently accounts for an estimated 50,000 deaths in the United States and Europe, which have surveillance to support those numbers. The CDC puts the number for the U.S. at 23,000. But the project, Review on Antimicrobial Resistance, commissioned by UK Prime Minister David Cameron, estimates the actual current death toll is 700,000 worldwide. This is a looming global crisis, yet one which the world can avert if we take action soon. Last thing, we know bacteria evolve. Please don't pressure your doctor to prescribe antibiotics.